February the 2nd, 1685. The morning began like any other in the opulent chambers of Whitehall Palace. King Charles II of England, the merry monarch, awoke to prepare for another day of courtly rituals and state affairs. By noon, he would be convulsing on the floor, surrounded by physicians who would spend the next 6 days systematically destroying his body in the name of healing. What you're about to hear is not a tale of medieval barbarism, but a documented medical case from the height of the Enlightenment. A king tortured to death by the very men sworn to preserve his life. The death of Charles II stands as one of history's most horrifying examples of medical hubris. This was not an execution, not an assassination, not an act of war. This was medicine, and it killed a king in the most agonizing way imaginable. The morning of the collapse. Charles Stuart was 54 years old on that cold February morning. He had survived civil war, exile, and political conspiracies that would have destroyed lesser men. He had outlasted Cromwell's Commonwealth and restored the English monarchy to its former glory. He was witty, charismatic, and beloved by many of his subjects. He maintained numerous mistresses, fathered at least 12 illegitimate children, and lived with an exuberance that earned him his famous nickname. On the evening of February 1st, Charles had complained of feeling unwell. Nothing alarming, just a general malaise and difficulty sleeping. He went to bed expecting to wake refreshed. Instead, he woke in agony. Around 8 o'clock in the morning, while being shaved by his barber in his private chambers, the king suddenly cried out. His face contorted, his body went rigid, then he collapsed to the floor, his limbs jerking in violent spasms. The barber screamed for help. Within moments, the chamber filled with courtiers and attendants, all watching in horror as their monarch thrashed on the Persian carpet. Foam appeared at the corners of his mouth. His eyes rolled back. The seizure lasted several minutes before subsiding, leaving Charles semi-conscious, confused, and terrified. The royal physicians were summoned immediately. Within the hour, 14 of England's most distinguished doctors had assembled in the king's bedchamber. They represented the pinnacle of 17th century medical knowledge. They had trained at the finest universities in Europe. They had treated nobles, bishops, and scholars. They carried with them leather cases filled with instruments, potions, and remedies that represented centuries of accumulated medical wisdom. They were about to kill their patient. Dr. Edmund King, one of the king's personal physicians, took charge of the situation. He examined Charles briefly, noting the king's rapid pulse, his pallor, his disorientation. Without conducting any thorough diagnostic examination, Dr. King made his assessment. The king had suffered an apoplexy, what we would now call a stroke. The treatment, according to the medical theories of the day, was immediate and aggressive intervention to rebalance the body's humors. What Dr. King and his colleagues didn't realize, or didn't care to investigate, was that Charles's symptoms were more consistent with a severe urinary tract infection or kidney stone, both eminently treatable conditions. The seizure was likely caused by a sudden spike in blood pressure or a reaction to toxins building up in his system due to kidney inflammation. With rest, fluids, and time, Charles Stuart might have recovered completely. Instead, the doctors prepared their instruments. The torture was about to begin. The first treatment, bloodletting. The theory of humoral medicine dominated European medical practice for over 2,000 years. According to this ancient Greek system, the body contained 4 humors: blood, phlegm, yellow bile, and black bile. Health required these humors to remain in perfect balance. Illness occurred when one humor became excessive or deficient. The treatment for almost any ailment, therefore, involved removing the excess or adding the deficiency. In Charles's case, the doctors believed he had an excess of blood. The solution was obvious. They would remove it. Dr. King ordered the king's arm to be extended. A leather strap was tied tightly around the upper arm to make the veins bulge. A silver basin was placed beneath. Then, with practiced efficiency, Dr. King took his lancet, a sharp, double-edged blade designed specifically for this purpose, and sliced open the basilic vein in Charles's inner elbow. Blood poured out. It was dark, almost purple, which the doctors took as confirmation of their diagnosis. Corrupt blood, they muttered to each other, nodding sagely. They let it flow freely into the basin, measuring carefully. 16 ounces. A full pint of the king's blood drained into the silver vessel. Charles, already weakened from his seizure, grew paler. His breathing became more labored, but the doctors were not finished. According to their calculations, more blood needed to be removed. They opened a vein in his other arm. Another 8 ounces flowed out. Within the first hour of treatment, Charles II had lost approximately 24 ounces of blood, nearly a quarter of his body's total supply. For a man already in medical distress, this massive blood loss was catastrophic. His blood pressure plummeted. His heart began racing to compensate for the reduced volume. His organs, including his already stressed kidneys, received less oxygen and nutrients. The doctors observed these changes with satisfaction. The king's rapid heartbeat, they believed, indicated that the treatment was working, that the body was responding to the removal of toxic humors. They did not understand that they were watching the early stages of hypovolemic shock. But bloodletting from the veins was only the beginning. The physicians had another, more aggressive technique in their arsenal: cupping. Heated glass cups were applied to Charles's shoulders and back. As the air inside cooled, it created a vacuum that drew blood to the surface of the skin. Then, the doctors made small incisions beneath each cup, allowing blood to pool and be collected. 8 more ounces of blood were removed through cupping. Charles drifted in and out of consciousness. When awake, he complained of terrible thirst and a pounding headache. The doctors interpreted the headache as further evidence of excessive blood and pressure in the skull. They prepared for the next phase of treatment. Purging and blistering medieval and early modern medicine operated on a principle of aggressive intervention. Illness was seen as an invasion or imbalance that must be forcibly expelled from the body. If bleeding didn't work quickly enough, doctors turned to purging, forcing the body to evacuate its contents through every possible orifice. The royal physicians prepared an emetic, a substance designed to induce violent vomiting. The concoction they chose was antimony, a silvery metalloid that had been used in medicine since ancient times, despite its well-known toxicity. In large doses, antimony causes severe gastrointestinal distress. In very large doses, it can be fatal. The doctors mixed antimony potassium tartrate, also known as tartar emetic, into a glass of wine. Charles, barely conscious and unable to protest, was forced to drink it. The effect was almost immediate. Within minutes, Charles began retching. His body convulsed as wave after wave of nausea overwhelmed him. He vomited repeatedly, violently, until there was nothing left in his stomach but bile and blood. The doctors held another silver basin to catch the expelled material, examining it closely for signs of the morbid matter they believed was poisoning the king. But vomiting alone was not sufficient. The body needed to be purged from below as well. The physicians prepared a powerful laxative combining jalap root, a New World plant known for its dramatic purgative effects, and calomel, a mercury compound. This mixture was administered rectally through an enema. The result was catastrophic for Charles's dignity and comfort. He experienced explosive diarrhea for hours. Attendants had to constantly change the bedding and clean the king as he lost control of his bowels. The combination of violent vomiting and severe diarrhea led to massive fluid loss and electrolyte imbalances. Charles' body was being drained of the water and minerals essential for organ function. His kidneys, already under stress, from whatever infection or inflammation had triggered his initial collapse, now faced an additional crisis. Dehydration reduces blood flow to the kidneys, impairing their ability to filter waste products. The toxic substances accumulating in Charles's bloodstream were beginning to reach dangerous levels. Meanwhile, the doctors prepared another treatment: blistering. This technique involved applying caustic substances to the skin to create large, painful blisters. The theory held that these blisters would draw out internal poisons and redistribute the humors. The physicians shaved Charles's head completely, leaving his scalp bare and vulnerable. Then they applied cantharides, a powder made from crushed blister beetles. This substance contains cantharidin, a potent toxin that causes severe chemical burns. When applied to the skin, it creates large, fluid-filled blisters within hours. Across Charles's bare scalp, angry red welts began to form. The pain was excruciating, but the doctors weren't finished. They also applied blistering agents to his neck, shoulders, and the soles of his feet. Anywhere they believed poisonous humors might accumulate, they burned the king's skin. Charles screamed. Witnesses later reported that his cries could be heard throughout the palace. Courtiers waited in antechambers, listening to their monarch's agonized shrieks and wondering if he would survive the night. The second day. Escalation. By the morning of February 3rd, Charles had survived one full day of treatment. He had lost over 30 ounces of blood. He had been purged from above and below until his body was wrung dry. His scalp and feet were covered in weeping blisters. He was delirious with pain and dehydration. Any reasonable physician might have concluded that the treatments were not working. A more thoughtful practitioner might have questioned whether the interventions themselves were causing harm. But 17th century medicine did not operate on principles of observation and adjustment. It operated on dogma. If the patient was not improving, the answer was not to stop treatment, but to intensify it. The royal physicians convened for a consultation. They examined the king's urine, a standard diagnostic practice of the era. What they saw alarmed them. Charles' urine had become dark, cloudy, and reduced in quantity. To modern eyes, these are clear signs of kidney dysfunction. To the physicians of 1685, they indicated an excess of black bile and a need for more aggressive purgation. They prepared a new round of emetics and laxatives, this time even stronger than before. They also decided to administer diuretics, substances designed to increase urine production. The logic seemed sound. If the king wasn't producing enough urine, they would force his kidneys to work harder. This was precisely the wrong approach. Charles's kidneys were already failing. They needed rest and support, not chemical stimulation. The diuretics the doctors administered included juniper berries, cantharides, the same substance that had blistered his skin, and alcohol, all of which placed additional stress on the failing organs. Charles' urine output did increase briefly, but the urine that emerged was darker than before, almost brown. It contained visible sediment and had a foul odor. These were signs of acute kidney injury. The organs were beginning to break down, releasing cellular debris into the urine. The doctors also noticed that Charles had developed a fever. His skin felt hot to the touch, and he alternated between chills and sweating. In reality, this fever was likely due to the infection that had triggered his original collapse, now worsening due to his weakened state. The physicians interpreted it differently. Fever, they believed, was another form of excess heat that needed to be cooled and expelled. They bled him again. Another 16 ounces of blood flowed from his veins into silver basins. Charles was now dangerously anemic. His organs were starved for oxygen. His blood pressure was critically low. But the doctors saw his pallor and weakness as signs that their treatments were drawing out the disease. Next came a procedure called scarification. The physicians took small blades and made dozens of shallow cuts across Charles's shoulders and back. They then applied heated glass cups to these cuts, using the vacuum effect to draw out even more blood. This technique was thought to remove localized poisons while preserving the patient's overall blood volume better than simple bloodletting. It didn't work that way. Charles lost several more ounces of blood, and the wounds became painful sites where infection could enter. In an era before antiseptics, every cut was a potential death sentence. Desperate measures, exotic remedies. As Charles' condition continued to deteriorate, the physicians became increasingly desperate. They turned to the exotic remedies that filled the pharmacopoeias of the 17th century, substances derived from far-flung corners of the world, from ancient texts, from folklore and superstition. One of the most disturbing treatments they employed was the king's drops, a medicinal preparation made from human skull. The recipe called for the skull of a person who had died a violent death, preferably a young person executed for a crime. The skull would be pulverized into a fine powder, then dissolved in alcohol to create a tincture. The theory behind this grotesque remedy was the doctrine of signatures, a belief that God had marked natural substances with signs indicating their medicinal uses. A skull from a person who died violently, it was thought, contained vital spirits that could be transferred to the sick patient, revitalizing them. The physicians administered 40 drops of this skull extract to Charles, forcing him to swallow the alcohol and bone mixture while he gagged and choked. There is no evidence that it had any medicinal effect whatsoever, though it may have provided a small amount of calcium and phosphate. They also gave him bezoar stone, a mass that forms in the digestive system of certain animals, particularly goats and deer. Bezoar stones were believed to be universal antidotes to poison, capable of neutralizing any toxic substance. The physicians ground the bezoar into powder and mixed it with wine, which Charles was forced to drink. In reality, bezoar stones are composed primarily of indigestible hair and plant matter. They have no antidotal properties. But they were extraordinarily expensive, traded along the Silk Road, and valued as highly as gemstones. The fact that the royal physicians were willing to use such precious substances demonstrated their growing panic. The physicians also administered extracts of viper flesh, pearls dissolved in acid, and a preparation called goa stone, a mixture of animal parts, herbs, and minerals believed to have been brought from Portuguese India. Each remedy was more exotic and expensive than the last, and each was utterly useless. Meanwhile, Charles' actual condition continued to worsen. His face had begun to swell, particularly around the eyes. His skin took on a yellowish tint, signs of jaundice caused by the buildup of bilirubin in his blood. His kidneys could no longer filter waste products effectively, and those toxins were accumulating throughout his body. The heavy metals. On the third day of treatment, the physicians decided to employ what they considered their most powerful weapons: heavy metal compounds. Mercury, arsenic, and antimony were the chemotherapy of the 17th century. Toxic substances administered in the hope that they would kill the disease before they killed the patient. Mercury had been used in medicine since ancient times. In the 16th and 17th centuries, it was the primary treatment for syphilis, applied topically or taken internally to purge the disease from the body. The treatment often caused mercury poisoning, but physicians believed the resulting symptoms, excessive salivation, tremors, tooth loss, were signs that the medicine was working. The royal physicians prepared a mercury-based compound and administered it to Charles both orally and through enemas. The effect on his already damaged kidneys was devastating. Mercury is a nephrotoxic substance, meaning it directly damages kidney tissue. It interferes with the organ's ability to filter blood and can cause acute kidney failure even in healthy individuals. For Charles, whose kidneys were already compromised, the mercury was essentially a death sentence. The tubules of his kidneys, the microscopic structures responsible for filtering waste, began to die. Dead kidney cells sloughed off into his urine, turning it even darker and giving it a thick, muddy consistency. Arsenic was administered as well, in the form of arsenious oxide mixed into a liquid. Like mercury, arsenic is profoundly toxic to the kidneys. It causes necrosis of renal tissue and can lead to complete kidney failure. The physicians had no understanding of these mechanisms. They only knew that arsenic was a powerful substance that caused visible changes in the body, which they interpreted as therapeutic. Charles began to experience the full spectrum of arsenic poisoning: burning sensations in his throat and stomach, severe abdominal pain, muscle cramps and confusion. His skin developed a grayish tone. His breath took on a metallic odor. The doctors observed these changes and nodded in agreement. The poisons were being drawn out of his body, they assured each other. The fact that Charles was growing weaker, not stronger, did not shake their confidence in the correctness of their approach. Kidney failure. By the fourth day, Charles II was dying of acute kidney failure. His urine output had decreased to almost nothing. What little urine he did produce was black and thick with sediment. His body was swelling with retained fluid, a condition called edema. His face became puffy and distorted. His legs and feet swelled so much that they had to cut away his stockings. The buildup of waste products in his blood, a condition called uremia, was now poisoning every system in his body. Urea, creatinine, and other nitrogenous compounds that should have been eliminated through urine were instead circulating through his bloodstream, reaching his brain, his heart, his lungs. Charles began to experience uremic encephalopathy, brain dysfunction caused by kidney failure. He became increasingly confused and disoriented. He didn't recognize the people around him. He spoke in nonsensical sentences. He experienced visual and auditory hallucinations, crying out about demons and shadows that only he could see. The smell in the room became overpowering. Uremia produces a distinctive odor, a sharp ammoniac scent that emanates from the patient's breath, sweat, and skin. It's sometimes described as a fishy or urine-like smell. The courtiers who entered Charles' chamber had to hold perfumed handkerchiefs to their faces to tolerate the stench. Charles' breathing became labored and irregular. Fluid was accumulating in his lungs, a condition called pulmonary edema, caused by the kidney's inability to regulate fluid balance. Every breath was a struggle. He gasped and wheezed, his chest rising and falling with desperate effort. The physicians recognized that something was terribly wrong, but they couldn't identify what. They had no concept of kidney function as we understand it today. They didn't know that the kidneys filtered blood, removed toxins, and regulated fluid and electrolyte balance. They saw the king's urine problems as a symptom, not as a sign of systemic organ failure. Their response was to administer even more diuretics, trying to force the kidneys to produce urine. They gave Charles preparations of squill, a Mediterranean plant that acts as a powerful diuretic and cardiac stimulant. They gave him juniper oil and turpentine. Each substance placed additional stress on the dying organs. Charles's kidneys were literally dissolving inside him. The combination of infection, dehydration, blood loss, toxic medications, and chemical damage had destroyed the delicate filtering apparatus. The nephrons, the functional units of the kidney, were necrotic and non-functional. The organs had become swollen, inflamed masses of dying tissue. The final agonies. On February 5th, the fifth day of his ordeal, Charles II experienced a brief period of apparent improvement. He became more alert and lucid. He was able to speak coherently and recognize his family members. The physicians celebrated this as evidence that their treatments were finally working. In reality, this improvement was likely a terminal lucidity, a phenomenon sometimes observed in dying patients where they experience a brief rally before death. It's thought to be caused by a final surge of stress hormones or a temporary metabolic change. It is not a sign of recovery. Charles used this window of clarity to put his affairs in order. He asked for his illegitimate children to be brought to his bedside so he could bid them farewell. He requested that his wife, Catherine of Braganza, be told that he had always loved her and begged her forgiveness for his infidelities. He asked his brother James to care for his mistresses and ensure they were provided for. Most poignantly, Charles asked to be received into the Catholic Church. This was an extraordinarily dangerous deathbed conversion. Catholicism was illegal in England, and the king's conversion could have triggered a constitutional crisis. A Catholic priest was smuggled into the palace in disguise, and Charles received the last rites of the church in secret, surrounded only by his most trusted confidants. After this brief period of lucidity, Charles's condition deteriorated rapidly. The toxins in his blood had reached critical levels. His brain was being poisoned from within. He began to seize again, violent convulsions that racked his body for minutes at a time. It took 4 strong men to hold him down and prevent him from throwing himself from the bed. Between seizures, Charles screamed. Witnesses later described the sounds as inhuman, animal howls of pure agony. The pain he was experiencing was total and overwhelming. His back arched in opisthotonus, a severe muscular spasm that bent his body backward like a bow. His teeth clenched so tightly that his jaw muscles bulged. Saliva and blood foamed from his mouth. The physicians watched helplessly. They had exhausted their arsenal. They had bled him, purged him, blistered him, and poisoned him with every toxic substance in their pharmacopoeia. Nothing had worked. The king was dying despite, or more accurately because of, everything they had done. On the evening of February 5th, Charles experienced a massive seizure that lasted nearly 15 minutes. When it finally ended, he did not regain consciousness. He lay in a coma, his breathing shallow and irregular, his pulse thready and weak. The court gathered around his bed. His wife Catherine knelt beside him, holding his hand and weeping. His brother James stood at the foot of the bed, his face ashen. The royal physicians stood nearby, still clutching their instruments and bottles, as if they might yet find some remedy that would turn the tide. Death. At approximately noon on February 6, 1685, King Charles II of England stopped breathing. His body, ravaged by 6 days of medical torture, finally surrendered. He was 54 years old. The immediate cause of death was listed as apoplexy. The actual cause was acute kidney failure induced by a combination of infection, dehydration, blood loss, and toxic medication. The treatments that were supposed to save the king's life had instead destroyed it. An autopsy was performed, a rare procedure for a monarch, but one that the physicians insisted upon, perhaps hoping to vindicate their approach. What they found should have horrified them. Charles' kidneys were, in the words of the autopsy report, greatly mortified, meaning necrotic and decomposed. They were swollen to nearly twice their normal size, discolored and filled with pus and bloody fluid. The tissue was so damaged that it fell apart when touched. These were not organs that could have sustained life under any circumstances. The autopsy also revealed significant damage to other organs. Charles' liver showed signs of toxic injury. His heart was enlarged and showed evidence of strain. His lungs were congested with fluid. His brain showed signs of edema, swelling caused by fluid accumulation. But perhaps most telling were the findings in his urinary system. A large kidney stone was discovered lodged in one of his ureters, the tubes that carry urine from the kidneys to the bladder. This stone, which had likely been the trigger for his initial collapse and infection, was completely treatable. If the physicians had simply identified it, managed the infection with supportive care, and allowed Charles's body to heal, he almost certainly would have survived. Instead, they had killed him. The physicians who conducted the autopsy drew no such conclusions. They wrote in their report that the king's death was inevitable, that the disease had been too severe, that no treatment could have saved him. They congratulated themselves on the thoroughness of their interventions and recommended their approaches for future cases. The aftermath and legacy. Charles II was buried with full royal honours in Westminster Abbey on February 14, 1685. His brother ascended the throne as James II, beginning a brief and tumultuous reign that would end in the Glorious Revolution just 3 years later. The medical treatment that killed Charles became a subject of both praise and criticism in the years that followed. Some physicians held it up as an example of comprehensive, aggressive intervention. Everything that could be done was done. Others began to question whether such extreme measures were truly beneficial. The great physician Thomas Sydenham, sometimes called the English Hippocrates, wrote a scathing critique of the treatment Charles received. Sydenham was an advocate of what he called expectant treatment, allowing the body's natural healing processes to work while providing comfort and support. He argued that many patients died not from their diseases, but from their doctor's treatments. Sydenham's views were considered radical at the time, but they represented the beginning of a shift in medical thinking. Over the following centuries, physicians would gradually move away from aggressive interventions like bloodletting, purging, and the use of toxic substances. They would develop a better understanding of anatomy, physiology, and pathology. They would learn to diagnose conditions accurately and treat them specifically rather than following general theories about humours and balance. But this progress came too late for Charles Stuart. He died in an era when medicine was transitioning from medieval tradition to modern science, caught in the gap between ancient theory and evidence-based practice. What should have been done? With the benefit of modern medical knowledge, we can reconstruct what probably happened to Charles II and what should have been done to save him. Charles likely had a kidney stone that caused a urinary obstruction. This led to a urinary tract infection that ascended to his kidneys, causing pyelonephritis, a serious but treatable kidney infection. The initial seizure was probably caused by a combination of severe pain, fever, and the systemic effects of infection. The appropriate treatment would have been simple: rest, fluids to maintain hydration and kidney function, pain management, and possibly some of the herbal antimicrobials available at the time, such as bearberry or birch bark extract. If the stone could be passed naturally or removed, the infection would likely have resolved. Charles's kidneys, given time and support, could have recovered. Instead, the physicians did everything wrong. They bled him, causing hypovolemic shock that reduced blood flow to his kidneys. They dehydrated him through violent purging, further impairing kidney function. They administered nephrotoxic substances like mercury and arsenic that directly destroyed kidney tissue. They failed to identify the underlying problem and instead treated imaginary imbalances based on flawed theory. Every intervention made the situation worse. Every treatment pushed Charles closer to death. The physicians, operating with the best intentions and the full confidence of their professional training, systematically destroyed their patient. This is the true horror of Charles II's death. It wasn't a case of medical ignorance. It was a case of medical knowledge that was completely, catastrophically wrong. The physicians knew exactly what they were doing. They followed established protocols and respected authorities. They did everything their education and experience told them to do, and they killed a king. Reflections on medical history. The death of Charles II serves as a cautionary tale about the dangers of medical dogma and the importance of empirical observation. The physicians who treated him were not incompetent or malicious. They were highly educated, experienced practitioners following the best medical knowledge of their time. And that knowledge was lethally incorrect. This raises uncomfortable questions about contemporary medicine. We look back at 17th century treatments with horror and disbelief. We wonder how educated people could believe that draining blood would cure illness or that toxic metals were therapeutic. But in 2025, there are certainly medical practices that will seem equally barbaric to physicians of the future. The history of medicine is littered with treatments that were widely accepted, vigorously defended, and completely ineffective or actively harmful. Lobotomies for mental illness, radical mastectomies for breast cancer, thalidomide for morning sickness. Each of these interventions was supported by respected authorities, taught in medical schools, and performed by conscientious physicians who believed they were helping their patients. The key difference between then and now is not that modern physicians are smarter or more ethical than their predecessors, it's that we have better systems for testing our assumptions. Randomized controlled trials, peer review, evidence-based medicine, these tools help us identify what works and abandon what doesn't. They're not perfect, but they represent a fundamental shift from authority-based medicine to empiricism. Charles II died because his physicians trusted authority over observation. They saw that their treatments were making him worse, but they couldn't question the fundamental theories that guided their practice. Challenging those theories would have meant admitting that everything they had learned, everything they believed, was wrong. That's a difficult admission for anyone to make, especially when a patient's life hangs in the balance. Conclusion. On February 6, 1685, King Charles II of England died screaming in agony as his kidneys failed and his body was consumed by the toxins his organs could no longer filter. He did not die from the illness that first struck him down. He died from the cure. For 6 days, the most skilled physicians in England tortured their king with every tool at their disposal. They bled him until he was anemic. They purged him until he was dehydrated. They blistered his skin, poisoned his organs, and filled his body with toxic substances. They believed with absolute conviction that they were saving his life. They were wrong. Charles' death was not an aberration. It was standard medical practice for the era. Countless other patients received similar treatments and suffered similar fates. Most of them were not kings, so their deaths went unrecorded and unmourned, but they were just as real, just as agonizing. The story of Charles II's final days reminds us that good intentions and sincere belief are not enough. Medical practice must be grounded in careful observation, honest assessment of outcomes, and willingness to change course when evidence demands it. It must be humble enough to admit uncertainty and flexible enough to abandon cherished theories when they prove false. Charles Stuart deserved better. He deserved physicians who would observe his symptoms carefully, identify the underlying cause, and provide supportive care while his body healed. Instead, he got physicians who followed their theories to their logical conclusion, regardless of the suffering they caused. In the end, medical knowledge killed the merry monarch. The very learning and expertise that should have saved him became the instruments of his destruction. He died not in darkness and ignorance, but in the full light of 17th century medical science, and he died screaming.